Welcome to the deep dive. Today, we're getting into something quite specific in veterinary cardiology.
We are left bundle branch block in cats and dogs.
Right, and we've gathered some info to really unpack what that means, what might be behind it, and interestingly, why it often just pops up unexpectedly.
Exactly. We'll look at the ECG, the heart tracing, and the different things that can actually cause it.
So our mission, really, is to get the core ideas, the important bits about left bundle branch block, without getting lost in, super technical jargon, what actually matters here.
Sounds like a plan.
Okay, so left bundle branch block, it sounds significant, an electrical thing in the heart. What's actually happening?
Well, think about the heart's wiring. It has these pathways, bundle branches, carrying the signal to the main pumping chambers, the ventricles.
Okay.
With a left bundle branch block, or LBBB, there's a holdup, a delay, or even a full block in the left bundle specifically.
Left one.
Yeah.
And that has different parts.
It does, the anterior and posterior fascicles. And when both are affected, that signal just doesn't get to the left ventricle efficiently.
So, what's the immediate effect? Does the heart stumble?
Not necessarily in terms of stopping, no. What happens is, quite interesting actually, the right ventricle gets its signal just fine through the right bundle branch.
So the right side contracts on time.
On time, yes. But the left ventricle, it has to wait. The signal basically has to creep across from the right side through the muscle itself.
Not down the fast track pathway.
Exactly. It's a much slower route, kind of like, one side of an engine firing before the other.
And that's what you see on the ECG, this delay.
Precisely. It creates a very specific, very recognizable pattern.
Okay, so what does that pattern look like? What are the key giveaways on the ECG for LBBB?
Well, the big one is the QRS complex duration. That part of the ECG represents the ventricles contracting, electrically speaking.
Right, the big spike usually.
Yes. Normally it's quick, but with this block, it takes longer for that left ventricle to fully activate. Longer? How much longer?
So in dogs, we're typically talking more than 0.08 seconds. For cats, it's usually over 0.06 seconds.
Okay. And visually on the readout?
It looks wider, obviously, but also in certain views, certain leads, like leads IT3 and AVF.
Those give different angles on the heart's electricity.
Right. In those leads, the QRS complex tends to be wide and mostly positive, pointing upwards. Often you might not see the little negative dips, the QRS waves that are sometimes there.
So wider and more upright in those specific views. Anything else characteristic?
Yeah. Another thing you often see is the QRS complex looks inverted or negative in lead AVR.
Flipped upside down in that one view.
Kind of, yeah. And interestingly, it's not always a constant thing.
What do you mean?
It can be intermittent. We saw an example, I think it was a Chihuahua, where the block would appear sometimes and then disappear on the same ECG tracing.
Huh. Comes and goes. Okay. That is surprising. So let's get to the why. What causes this? You mentioned the left bundle is pretty robust. It is. It's a substantial structure, so you usually need a fairly significant lesion, some kind of damage, to knock out both fascicles and cause a complete LBBB.
But you also said something crucial. It often doesn't cause immediate problems.
That's the really key takeaway, I think. Despite this electrical delay, it often doesn't mess with the heart's actual pumping function right away. No major hemodynamic issues, usually.
So it gets picked up. How?
Frequently, it's just found incidentally. You do an ECG for some other reason, maybe a pre-anesthetic check or investigating something else, and boom, there it is. The animal often shows no signs directly from the block itself.
That's the aha moment you mentioned.
I think so. It shifts the focus. The block itself isn't the emergency, but why it's there might be.
Right. So what are those underlying reasons? What kind of heart problems can lead to LBBB?
Well, there are several possibilities. Cardiomyopathy is a big one, disease of the heart muscle itself.
Different types, like dilated or hypertrophic.
Yes, various forms can potentially be involved. Then there's trauma.
Trauma, like an accident.
Exactly. Direct trauma, like, say, being hit by a car, or even sometimes indirect effects. Even certain medical procedures, like a needle puncture into the heart, could potentially damage the conduction pathway.
Wow. Okay, what else?
Neoplasia tumors. If a tumor grows in or near the heart, it can disrupt things.
Makes sense.
Also, conditions like subvalvular aortic stenosis, that's a narrowing below the aortic valve, and simple fibrosis, scar tissue forming in the heart muscle, potentially from past inflammation or just chronic strain. Sometimes pathologists can actually see this scarring right in the bundle branch area.
Scar tissue blocking the signal path. And you mentioned ischemic cardiomyopathy, too.
Yes, that's specifically related to reduced blood flow to the heart muscle.
Like a heart attack.
Sort of, yes. Myocardial infarction is one cause, but also narrowed coronary arteries, arteriosclerosis, or even severe thickening of the heart muscle, hypertrophy, that physically squashes the coronary arteries.
So quite a range of potential underlying problems.
Definitely. Damage, disease, structural changes, blood flow issues, they can all potentially lead to LBBB.
Okay, so given that the block itself isn't usually causing the symptoms, what might an owner actually see, if anything?
That's just it. Often nothing specific to the block. Any signs you do see are almost always because of the underlying condition.
Right. So it's a cardiomyopathy causing the LBBB.
Then you might see signs of heart failure, things like getting tired easily, maybe coughing, difficulty breathing. But those are signs of the cardiomyopathy, not the LBBB directly.
So the LBBB is more like a clue, a signpost pointing towards a deeper issue.
Exactly. It tells us something is wrong structurally or functionally, even if the electrical delay itself isn't the main problem right now.
And diagnosis then is primarily that ECG, seeing those specific changes.
Yes, the ECG is the main tool. That prolonged QRS, the specific shapes in those leads we talked about, that's how you spot it.
What about catching it if it's intermittent, like that Chihuahua example?
That's where a Holter monitor comes in really handy.
The wearable ECG.
Right. You put it on the animal for, say, 24 or 48 hours, and it records everything. It's much more likely to catch a block that only happens occasionally compared to a quick, 5-minute ECG in the clinic.
That makes sense.
Yeah.
Now, could anything else look like LBBB on an ECG? How do vets rule out other things?
Good question. Differential diagnosis is key. Sometimes significant left ventricular enlargement, just the chamber being bigger or thicker, can cause some similar ECG changes.
So how do you tell the difference?
Usually imaging helps sort that out. Chest x-rays, or even better, an echocardiogram and ultrasound of the heart can show if the ventricle is enlarged.
Okay. Anything else?
Ventricular ectopic beats, those extra early beats coming from the ventricle, can sometimes look wide like an LBBB beat. But with LBBB, you usually have a normal heartbeat rhythm driving it, so there's a consistent relationship between the atrial signal, the P wave, and the ventricular one, the QRS. You don't typically see the pulse deficits, skipped beats, when you feel the pulse that you might get with frequent ectopics.
Got it. So consistency is key there.
Yeah.
All right. We found the LBBB. What's the bigger picture? What happens next? Management. Implications.
Well, the most important thing, and we keep coming back to this, is that you don't treat the LBBB itself directly.
Because it's not usually the root problem.
Exactly. The entire focus shifts to finding and managing the underlying cause.
So figure out why the block is there. If it's cardiomyopathy, treat that. If it's related to stenosis, address that, and so on.
Precisely. And client education is huge here.
Explaining that even if the pet seems fine now.
This ECG finding is a flag. It means there's likely something going on with the heart that needs attention, monitoring, maybe treatment.
And things could change over time.
Yes, that's a real possibility. The underlying lesion, whatever caused the block, could progress. It might worsen.
Leading to.
Potentially more significant arrhythmias down the line, or even in some cases, progressing to a complete heart block, where the signals from the atria don't get through to the ventricles at all. That's much more serious.
So regular checkups and repeat ECGs are important for monitoring.
Absolutely. Serial ECGs are key to track any changes.
You mentioned pathology earlier, looking at the heart after death. What might they find?
Well, as we touched on, they might see visible lesions like fibrosis or scarring right along the path where those left bundle branches run on the inner surface of the ventricle.
The endocardium.
Yes. And there was that interesting detail about using Lugol's iodine solution.
Oh yeah, the staining technique.
Right. If applied soon after death, it can apparently help highlight the conduction system tissue, making it easier to see subtle damage or scarring in those bundle branches.
Fascinating stuff, even post-mortem. Okay, let's wrap this up. What are the absolute key takeaways for our listener about left bundle branch block?
I'd say number one, LBBB is an ECG finding. It shows a delay in the left ventricle's electrical activation.
But not usually a problem in itself.
Correct. Number two, it's often found incidentally. The animal might seem perfectly fine.
Doesn't mean everything is fine, though.
No. Which leads to number three. Its presence strongly suggests an underlying heart issue, could be muscle disease, damage, something else that does need investigation and management.
So the block is the signal, not the source of the immediate trouble usually. Find the source, manage the source.
That's the core message.
Right. It really makes you think, doesn't it?
Yeah.
If LBBB is often this sort of silent electrical finding, What other subtle things might be going on electrically inside our pets' hearts that we just don't routinely pick up on?
That's a great point. What else is happening silently?
Yeah, what could more advanced monitoring or research uncover down the line? Definitely food for thought. Thanks for diving deep into this with us today.
My pleasure. Always interesting to explore these electrical pathways.